I have found such a beautiful community in California. I have fallen in love with the people and the nature and the culture, and I just can't wait to get back there in the fall. But this time, as I'm planning my next trip to LA, I don't want to just leave my place unused when I could easily be making extra money and just Airbnb my home while I'm away. I am an avid user of Airbnb, and I'm excited to try out the hosting side of it. So for the next trip you plan, just remember that while you're away, your home could be an Airbnb, and it might be worth more than you think. Find out how much at airbnb.ca/host.
Hey you, Bravo's now in Canada.
I just got chills.
If you know Bravo.
I love that.
You love that?
You know Vanderpump Rules.
Why does it have to get so complicated?
Summer House.
Don't activate me because you've not seen me activated.
Below Deck.
I'm not your friend, I'm your captain.
Top Chef.
Hi, Chef.
And Housewives. Definitely Housewives.
I'm not gonna lie, I'm looking forward to this.
Bravo, now available.
It's insane.
Subscribe now with your TV service provider.
Fall in Canada has never been hotter.
Frequency Podcast Network. Stories that matter, podcasts that resonate.
Should a religious provider run a publicly funded service? Well, it happens every day in hundreds of Catholic schools across 3 Canadian provinces. But here's another question. Are schools different from hospitals? And if they are, then how? Last week, it came to light that Alberta's Premier Danielle Smith plans to turn stewardship over several public hospitals currently run by Alberta Health Services over to Convenant Health, a Catholic healthcare provider.
We need Alberta Health Services to focus on delivering the best care in the 106 facilities they operate for us. So we're taking away all of their excuses. We're moving the hospital authority over to Convenant Health.
Now, providing better care and faster care is a noble goal. But as you might imagine, taking hospitals away from a secular public organization and turning them over to a private religious organization has raised a ton of questions, along with no shortage of outrage. So what does allowing Convenant Health to run these hospitals look like in practice for patients? How do we know that they'll do it faster or better? And what do Albertans who need the services provided in these public hospitals do when the organization that now runs theirs refuses to provide them? I'm Jordan Heath Rawlings. This is The Big Story. Lauryn Heintz is a reporter with CityNews in Calgary who has been following this story, as well as the overall decentralization of healthcare in Alberta. Hello, Lauryn.
Hi, Jordan.
Thanks for finding some time for us on Tuesday after Labor Day.
Yeah, well, thank you for having me to talk about this really important story here in Alberta.
Why don't you rewind for folks outside of Alberta or people who maybe only saw a headline late last week? What did we learn last week about what is happening to Alberta's hospitals?
Right. So around this time last week, we began to see video footage of Alberta's Premier Danielle Smith talking at a party-run town hall event in a town called Drayton Valley. And during this fireside chat of sorts, she began to describe the process that the province is undertaking at the moment, which is taking away hospital authority from Alberta Health Services and giving it to a private Catholic-run healthcare organization called Convenant Health.
Before we get into who they are and what they do, how unusual, I guess, or strange was it to get this kind of information in that kind of environment? This is something that I gather, like no reporter was on, had not been in policy documents or anything?
That's right. So the actual event happened, I believe it was on August 17th. And so when most of us reporters were hearing about this for the first time, it was already about 10 days old. And we learned about this because a reporter working for a smaller news outlet in the area had published a story essentially recapping this event. And it went wild, as you can expect, especially because we were all kind of shocked, to say the least. It's not necessarily surprising to learn that the Alberta government is pushing for more privatization in some areas. But I suppose most of the shock was partly in the way the message was delivered, in that it was not in a big public venue. There was no media release. And it later came out that there was other big sort of policy announcements regarding other avenues of Alberta legislation that were also discussed at this event and not brought to the attention of us larger media organizations.
And what is the timeline on this? Because this is the other thing that surprised me a little when I read the report. I gather this is a changeover that is happening or even already happened or will soon happen. This is not, here's our timeline for next year's policy.
Right. So the answer differs a bit depending on who you ask. And ever since this news came out, the province has been quite particular in the way that it responds to questions about this topic, mostly because it is so, or has been so controversial since the news first came out. But upon talking to representatives from Convenant Health, they actually told me that 3 years ago, in August of 2021, Alberta's provincial government committed money to build what they call a maternity and community health center in Lacrette, which is the hamlet where this hospital that's being switched over is located. They said that they've been working with the province to build this community health center for over 3 years, and that Alberta Health Services at the time was the operator and provider of health services in that community. However, in April 2 years ago, they apparently announced that Convenant Health was going to be the operator of that new facility. They advertised this as a collaboration, that Convenant Health is working with Alberta Health Services, not against, and that the whole idea is this is going to elevate care for people in that community. This kind of contradicts even words that the Premier herself has said, in that she believes health services will thrive and get better with competition, which raised a lot of alarms for some people, given that they don't believe that this should be one of those services that people or companies have to compete for to get the best deal.
Who are Convenant Health, and why is it significant, I guess, from a patient's perspective that they will be taking over management of some of these hospitals?
Right. So Convenant Health is a Catholic healthcare provider that operates in Alberta's so-called integrated health system. In its own words, Convenant says that it is called to continue the healing ministry of Jesus by serving with compassion, upholding the sacredness of life in all stages, and caring for the whole person in body, mind, and soul. Right now, it runs 17 sites in 12 communities across the province. And this is significant because the organization has made it clear that they have the right to operate and provide services based on their Catholic beliefs.
Give us an example of what kind of services we're talking about here.
Right. So particularly reproductive services are in question here. It gets a bit confusing because if you go to look for information about services on Convenant Health's website, they provide you with a wealth of information ranging from obstetrics to menopausal care, women's cancer clinics, things like that. However, they don't ever specifically mention services like abortion. And when asked, representatives did not respond to questions on whether or not those facilities would provide abortions. The other service that is in question here is medical assistance in dying, otherwise known as MAID. And Convenant has said that they will not or do not provide medical assistance in dying services at their facilities.
So has there been, and I obviously realize that, in most cases the changeover hasn't happened yet, but has there been any kind of guidance for patients? These are hospitals in rural areas, right? There's not a lot of alternatives for somebody who might need reproductive care or want to access MAID. What happens to those patients?
That's really the big question here is, do people still feel that they can be adequately served by a healthcare provider that is running by its own set of rules? I was able to find that the closest Alberta Health Services operated hospital is about 30 minutes away in a town called Fort Vermilion. And you would think perhaps that would be feasible for some people to go to that community and access care. But then you wonder about potentially people that are looking at accessing MAID and what their health situation is, whether it be physical or mental, and that short drive might not be doable for them. And the idea that people should be able to access healthcare in their community and that it should be readily available is really called into question when you're looking at privatization, especially with an organization that runs on religious views.
I've been spending more time in California lately, and I just love it there. Literally every time I'm there, it just feels like that song, I Think I Like This Little Life. And I can't wait to get back there to my friends and the community that I've built. I'm hoping to get back in the fall, but every time I visit LA, I've realized I could easily be making some extra money if I just Airbnb my home while I'm away. I always love staying in Airbnbs when I'm away, so I can just settle into a good routine, and I'm excited to host people in my home too. Whether you have extra space in your home or you're looking to make some extra money while you travel somewhere fun, your home might be worth more than you think. Find out how much at airbnb.ca/host.
Hey, you. Bravo's now in Canada.
I just got chills.
If you know Bravo,
I love that.
You love that?
you know Vanderpump Rules,
Why does it have to get so complicated?
Summer House,
Don't activate me because you've not seen me activated.
Below Deck,
I'm not your friend. I'm your captain.
Top Chef, and Housewives. Definitely Housewives.
I'm not gonna lie, I'm looking forward to this.
Bravo, now available.
It's insane.
Subscribe now with your TV service provider.
Fall in Canada has never been hotter.
Can you explain maybe a little bit more about how the privatization aspect of this comes into play? Because to be clear, these hospitals are still not going to be charging patients for private services, right? But now it's a Catholic organization that will be billing back to the government for them. Is that right?
I think that is correct. My understanding is that the way patients access care would not be any different from how they would access care at a facility run by Alberta Health Services. The real difference that comes into play is the care that they are able to access.
What has Premier Smith said about why this needs to happen? Like, what's the current state of these facilities that would demand this? Or just like, what's the reasoning here, I guess?
Issues have kind of been permeating Alberta's healthcare system, specifically rural healthcare, for a long time now. It's not uncommon to see any day of the week that a rural emergency department is shut down for any length of time. And typically that is attributed to a lack of physician coverage or nurse coverage. And so Premier Smith has essentially said Alberta Health Services is not doing a good job at managing their facilities, and therefore that responsibility needs to be given to someone else who she believes can do a better job.
Do we know if they do a better job? Like, they provide care in other facilities already, right? They have their own. So what do we know about whether they're faster, more efficient, et cetera, et cetera?
So when this conversation initially began with Smith's comments at this town hall, she made claims saying that Convenant Health had never closed an emergency department. They had never left the people in their community without emergency room care. And a quick Google search of their facilities shows that that is in fact not true. There were posts for some of their rural facilities dating back months ago. They echo some of the comments we've seen about AHS facilities of them having to be closed overnight or for several hours because they don't have a doctor. So we really don't know. We don't have apples to compare in this situation. But we do know that AHS has closed emergency rooms, and we do know that Convenant Health has also been forced to close some of their emergency rooms.
What have the reactions been from Albertans in general since the news broke?
I'd say they're mixed. There are some people that say, if this is the way to get us out of this hole that we found ourselves in with healthcare, then why not take that opportunity? But then there are others who say this goes against kind of what we stand for, in that healthcare shouldn't be privatized. I'd say the biggest point of contention and conversation around all of this is really what this means for services like gender-affirming care, abortion, MAID, all of those services that are already being called into question by legislation that's being proposed by the United Conservative government and is now perhaps getting closer to reality with these transitions that are being planned and have already taken place in some cases.
As you cover healthcare in general in the province, I guess the last thing I want to get at is, what are you seeing or hearing in the big picture that this is a part of? What's happening to Alberta's healthcare system right now? And what are you watching for in the months to come?
Frankly, it's collapsing. I don't think there's a better way to put it. And we're not just talking about hospital care here. We're talking about surgery wait times. We're talking about the fact that as many as 700,000 Albertans don't have a family doctor. There are numerous problems with Alberta's healthcare system. And so far, the province's solution to that has been essentially a proposal to decentralize Alberta Health Services. And so they've said they want to separate the agency into different sections in order for them to, they say, more adequately address each of them. And so far, we haven't seen that happen. They've started to make some inroads in terms of changes to mental health and addictions care in the province, which, of course, has also drawn ire from many critics for their approach. And honestly, it's kind of scary. You don't really know where we can go from here. And you hope that it won't get worse, but you're not necessarily hopeful that it will get better. The outlook for healthcare in Alberta right now is quite dismal. And this fits into that network of potentially taking away vital care from people who need it most and people who are very, very far away from major centers where they may otherwise be able to access this care very readily. And I think people are worried, and I think they're unsure of what's next. I think in the next weeks and months to come, I will be watching for what happens next in the decentralization process, what happens to essential healthcare services in the province, and what that means for the people who need to access them. Just early last week, we learned about a new first-of-its-kind for-profit healthcare center being built in Airdrie, just north of Calgary, a city of thousands that does not have a hospital. And the province gave that company $85,000 to do a research plan to build this private health facility. And especially ahead of leadership review for Premier Danielle Smith in the next few months, we're expecting to hear lots of announcements on changes to policy and legislation that will impact all aspects of Albertans' lives, but especially healthcare.
Lauryn, thank you so much for walking us through this. Sounds like interesting times out there for people who need care.
Yes, it's quite something, Jordan, and we hope to get more answers as the days come, but it's an ever-evolving story that affects many people.
Thank you so much for joining us.
Thank you for having me.
Lauryn Heintz is a reporter with CityNews in Calgary. That was The Big Story. You can find more big stories at thebigstorypodcast.ca. You can always send us feedback on this story or any other episode you hear by writing to us at hello@thebigstorypodcast.ca or by calling us and leaving a message, 416-935-5935. We're in all your favorite podcast players, and of course, we're on your smart speaker when you ask it to play The Big Story podcast. Thanks for listening. I'm Jordan Heath Rawlings. We'll talk tomorrow.
I have found such a beautiful community in California. I have fallen in love with the people and the nature and the culture, and I just can't wait to get back there in the fall. But this time, as I'm planning my next trip to LA, I don't want to just leave my place unused when I could easily be making extra money and just Airbnb my home while I'm away. I am an avid user of Airbnb, and I'm excited to try out the hosting side of it. So for the next trip you plan, just remember that while you're away, your home could be an Airbnb, and it might be worth more than you think. Find out how much at airbnb.ca/host.
Hey you, Bravo's now in Canada.
I just got chills.
If you know Bravo,
I love that. You love that?
you know Vanderpump Rules,
Why does it have to get so complicated?
Summer House,
Don't activate me because you've not seen me activated.
Below Deck,
I'm not your friend, I'm your captain.
Top Chef, and Housewives. Definitely Housewives.
I'm not gonna lie, I'm looking forward to this.
Bravo, now available.
It's insane.
Subscribe now with your TV service provider.
Fall in Canada has never been hotter.